I wanted to talk just a minute about the nursing shortages that we're seeing in the headlines. We're seeing it on the 6 o'clock news practically every night that the hospitals are short, nursing homes are short, doctors' offices are short. This didn't just happen. It's been going on for a long time. If you reach way back into the 70s and early 80s, and you looked at women's roles in what they could do in work, and typically what you'd find was women were involved as secretaries, they were involved as school teachers and school principals, and they were involved in the nursing profession. So those were really the three professions that predominantly female workers were involved in. That all changed in the late 70s and 80s. Now women have opportunities to do just about everything that men do. So things have changed quite a bit, and that's had a huge point of pressure on the nursing profession. When you think about it, all those people, all those women who were in the nursing profession earlier are now retiring, so we've got all those openings. The pandemic came around and put severe pressure on the nursing profession for a lot of reasons. There's reasons of vaccination and people being not in favor of vaccination, so we lost nurses because of that. There's some apprehension about being a nurse now with a pandemic going on out there and bringing something home to your family. And beyond that, when we're thinking of families, we've got kids who couldn't go into classrooms anymore, had to go virtual, so somebody had to be with those kids at home, help them through their schoolwork and that kind of thing. So you can see that there's been a lot of pressure on the nursing profession, and it didn't just happen because of COVID and the pandemic. It's been going on a long time, even though it just kind of hit the news lately. The good news is that there's a lot of things going on around the medical profession and nursing in general that's going to help to pull people in. First and foremost, it's a rewarding profession. You can get the benefit by seeing a smile on people's face right away when you come to bedside to help them. There's nothing like that. Beyond that, there's the more technical pieces. Hospitals, nursing homes, all kinds of medical facilities are recognizing that they have to be more flexible. It can't be 24 hours a day, 7 days a week that a nurse has to work. There are other kinds of programs now, other kinds of approaches that recognize that people's time is very important. So that's a big benefit. The other thing is governments, other kinds of incentives, scholarships are coming down to make it affordable for people to come into the nursing profession. There's a lot of things happening out there to make the nursing profession something that's acceptable now to anybody who wants to get into it and has a heart for that kind of job.